Hi, Taya Countryman here today with my friend Bob. So we're going to talk a little bit about why the quads are so misunderstood. So we always need to do a little bit of standing assessment. We've rolled his shorts up a little bit, and what I'd like you to do for me now, Bob, is can you do a slight squat for me? What I want you to really notice is he talks about this ankle, his left ankle, but look how he's using that Vastus Medialis there and how it's sticking out. And come back up. That's great. So it says that he's over contracting that for balance, and so there's a really good chance that he might have an SRT tender point there. So let's get him on the table and let's talk about structure a little bit. Now that we have Bob on the table, I want to talk a little bit about the structure of the quads. And we all know the rectus femoris, but all of the quads actually come into the patella tendon. So that when he extends his knee, can you lift your lower leg up? You can see the outline of his big rectus femoris, and you can see some engagements of the vastus lateralis and the vastus medialis. Thanks, Bob. But this is where Taya differs sometimes. Just knowing what the book says is the action and how we functionally use our bodies is really different. So when we look at the vastus lateralis, for example, you have to also remember that the fibers also attach to the posterior side of the femur in this direction. They never really cross a joint except at the patella tendon. So what's all of this for? Well, I think it's for balance. I think they're big balancers. And so when there's an accident, skiing is one of the best ones, but any kind of a slip or fall or an accident where you're trying to catch your balance, the vastus lateralis and the vastus medialis are the muscles that are trying to save you. They're shorter than the rectus femoris, so they're stronger. So let's now look at where they're actually located. There's the IT band, there's the rectus femoris, and they're in that space right in between. And when we had Bob do a slight squat, you could really see the vastus medialis sticking out. And oftentimes when people have an accident, they're actually pointing to the lower part of that vastus medialis. But in this case, he has tender points, we've already checked, SRT tender points in the vastus lateralis and in the medialis. So next we want to show you how you can treat them. The other thing I want to talk about, though, before we actually treat them is that middle hamstring. When you reach under and you feel that middle hamstring and it feels like sort of a big knot, or people keep putting their hands on it and say, I'm really tight in my hamstring. I want you to start thinking vastus lateralis and vastus medialis, because if you have a segment of them that are in involuntary contracture, that's what's creating the tension there. So if you feel for tension first, then you do your treatment, you can get your reward afterwards and feel the difference in the hamstring. Now let's find a tender point. I'm going to feel first. Feels really tight there. And I'm going to doorbell it. Is that tender right there? It is tender. So we're going to use that as our tender point. So I'm going to shift hands and use this thumb. Right there is tender. I want to shorten those fibers. So I'm going to be just below where the tender point is. I'm going to give compression downward, and I'm also going to give pressure upward or superior, and then I'm going to go in the same direction of the fibers without rolling his leg outward, and I'm going to test it. Better, same, worse, or gone?
Better.
Better, but not gone. I'm going to give a little more in all of those directions. Better, same, worse, or gone?
Better.
Okay. Gone?
Gone.
Gone. and I'm going to need 2 hands to do this. Shortening this muscle and giving it 90 seconds is going to stop the involuntary muscle contraction. And you're going to stop mistaking the vastus lateralis for the IT band. How's my pressure, Bob? Okay?
It's good.
Good. We're going to hold for 90 seconds. 90 seconds has gone by, so now I can take my hand off. And actually, what I'm going to feel for is how much softer Bob feels in here. And that's a great reward. Now I'm going to reach under and feel the hamstring, and especially on this half, it's very soft. But it does mean we're going to have to look for a tender point in that vastus medialis, because he's been using that as balance to offset this ankle. So now we want to look at the vastus medialis, and I just want to feel for the tightness. The tightness of the tissue will lead me to that SRT tender point. And I'm going to try it right here. Is that tender, Bob? Okay. So that's the one I'm going to use right here. So again, I want to put pressure on the leg. I'm going to go superior with my pressure, and then I'm going to rotate it medially, and I'm going to test it. Better, same, worse, or gone?
Better.
Ooh, you know, my grip's not quite right, so I'm going to try the heel of my hand here. Pressure, up, and then down, and then I'm going to test it. Better?
It's gone.
Gone.
Yeah.
Okay, I'm going to stabilize his leg, and I'm going to keep this pressure on for 90 seconds. After 90 seconds, you can release your pressure, and your big reward comes in how the middle of that hamstring feels. So now I'm going to reach underneath, and I'm going to feel how soft that is when I lift my fingers up. How does that feel for you, Bob?
Good.
These 2 muscles are key in any kind of accident or athletics. It's really important to address them. And the vastus lateralis and the medialis can have several tender points, and you can treat them all in the same session. Just make sure that you're not in the rectus femoris and you're not in the IT band. You're going to be right along that edge. Let me tell you a great story. I have a patient that's been with me for a number of years, and when we were home in Lake Stevens, Washington, she called me and said, "I fell skiing. I've been seeing the PT and my knee's just not getting any better." So she came to see me. Where she pointed to was exactly where I treated his vastus medialis. And they were rehabbing it, but the problem was that vastus medialis was sticking out and it was contracted in the way that she fell. As soon as we released that, her pain went away. Using structural relief therapy, shortening the muscle and giving it time to release is what you're really going to need to be an excellent therapist. Thanks.